Welcome to this Global Health series. I'm Vivian Kosije Birchall, your host, and with me is a team of young cuddlers who are working on a project in Nigeria. But before we dig into those details, I would like to invite each and every one of my guests to please introduce yourselves. Tell us what you do currently and what part you play. Yeah, let's start with what you do currently and where you are right now. And I'll start with Patrick.
Hi, Vivian, and hi, everyone. My name is Laden Yimo Patrick. I am a student at Rutgers University, the State University of New Jersey, and I currently work in a research lab where I work on mitochondrial ATP synthase. And in terms of, as it relates to this project, I am the founder of the STEM Guardians, which is a Global Health Catalyst Club that was responsible for the project that we'll be talking about today. And right now, I am in Philadelphia. Pennsylvania.
Awesome.
Thank you.
Welcome. Ishan?
Yeah, so my name is Ishan. I just finished up my undergrad and I'm actually from Florida. I was introduced to the GHC by my professor and my very dear mentor, Dr. Lydia Sana. And I've been working with the GHC at the previous two conferences, and right now I'm working on research and a few other projects, side projects, and I'm glad to have joined this project after I met Patrick. And yeah.
Excellent. Welcome. Dr. Arthur?
Yeah, my name is Dr. Arthur. I'm from Kenya. I'm currently in a city called Kisumu. I'm a medical doctor by profession and currently involved in cancer control and cancer management. And also cancer research, and palliative care, of course, for cancer patients. I was introduced to the Global Health Catalyst program by, of course, through Patrick, but also through Professor Will Ngwa. And I've been passionate on cancer control since I was a medical student. So I'm in the right place at home for this endeavor on cancer control globally, and also especially in Africa and all the other low and middle income countries. Thank you.
Thank you, Dr. Arthur. I will catch you on one thing. As an African, you introduced yourself as Dr. Arthur and you missed the African name. That is.
Yes, my name, I'm African. Yeah, my name is Dr. Arthur Ajuang. You know, that second name is normally very difficult to pronounce, but it's Dr. Arthur Ajuang.
It's not difficult. Everyone needs to know our names. That's the project. Anyway, Flory.
Yes, hello. My name is Flory Augustine Solebitege. So I'm originally from Gabon. So I'm a lecturer on a master program in biotechnology at Northeastern University in Boston. So I also do cancer research in the field of photoimmunotherapy. So I joined the Global Health Catalyst and I met Patrick during the Global Health Catalyst Summit earlier in June 2024, where I was leading the Gabonese delegations because I'm trying to promote the development of precision medicine for cancer patients. And this is one of the contribution that I also had with Patrick's project in Nigeria.
Oh, excellent. It's welcome to all of you. Thank you for being here today. I think that's a great segue into our, why we're here. Starting with Patrick, what was this project and what came out of it, or what have you been doing since you initiated it?
Yeah, so the idea of the club, STEM Guardians, actually was inspired by Dr. Wilfred Ngwa when he was visiting at Rutgers University, which is the State University of New Jersey. And we thought about what we could do to kind of replicate the idea of the STEM Avengers, basically real-world superheroes trying to tackle real-world problems. And so the STEM Guardians was inspired by then our desire really to bridge the gap between STEM education, particularly in underserved areas. So we wanted to create a platform that not only promotes science, technology, engineering, and math, but also highlight these fields as having relevance in trying to address world challenges. So our mission really was, can we empower young minds with knowledge and skill that could tackle issues like healthcare, disparities, environmental challenges, and technological inequalities, particularly in places where there's lack of access to STEM education. So that is where it all started. And so during this, the last Global Health Catalyst at Johns Hopkins, I met a few great friends, the ones, some of which are on this call. And I said, I have this wonderful idea. Can we think about doing something? And we spent some months after the Global Health Catalyst and had lots of meetings, thanks to Ishan, who was organized a lot of the meetings. And I also had been introduced to Inspire to Live. And so Inspire to Live connected me with Dr. Arthur. And so we sort of looked at cancer because we thought cancer is a growing public health concern in Africa and many low-income areas that lack proper knowledge about the disease. And so we chose to focus on cancer awareness because we believe that early education is key to prevention and better health outcomes. So we said, oh, perhaps we could target high school students. And so we set out to educate young people about the importance of cancer, knowing stuff about cancer, early detection, and healthy life choices. And we thought that it's important because that can help them make great life choices and reduce the risk of cancer. So essentially, that was how it all started. And so we set out to do a cancer awareness in Nigeria at a high school.
Thank you for sharing that. Ishan, you've been mentioned, so I'll go next to you. You're the coordinator of sorts of this meeting, seems like. But what has been your experience with this project in Nigeria, and what role are you playing in this particular project?
Yeah, so for me, what I loved about this project is how we were all in different parts of the world and coming together to have a grassroots effort in Nigeria. And I was surrounded by individuals who were smarter than me, more experienced than me, more educated than me. And like I also met Dr. Fleury at the GHC conference, and he shared very similar ideals throughout this whole project and with his experience. For me, I was mainly learning, so I was kind of coordinating the meetings and making sure everything was set up for everyone, stuff like that. Because of course, I could not contribute as much as some of the professionals who were there and giving lectures at the event in Nigeria. So I'm thankful to learn, and now we're focusing on launching more events similar to this and making our grassroots impact even larger because we want to target communities that can directly feel impacts, and so we can measure how much change we're making on the ground for people.
Excellent. Dr. Flora, your name has come up, and so I will go to you. And yes, I also did meet you at the GHC. I think we even took a picture together. But anyway, what's your role in this project? And
I mean, thank you very much, Vivian, again. So I was supporting also from an organizational point of view, but also I was also presenting, as I mentioned, on photoimmunotherapy. The reason being is because I did all my tertiary education in South Africa, especially at the University of Cape Town, where I was working in the lab where we try to develop precision medicines for African cancer patients, right? That suffers from brain cancers. And that light-based therapy that is known as photoimmunotherapy, I'm trying to kind of educate more people because it's a viable alternative therapeutic options to other therapies such as radiotherapy, right? So, in participating in this event, my first aim was to educate people on what is photodynamic therapy and photoimmunotherapy, and also showing to the audience, the scientific audience, or how African people can take advantage of this type of technology to address the management of clinically relevant diseases such as cervical cancer and breast cancer. So that was the main message. And I'm also very happy to work with Patrick, Ishans, and all these very young scientists because I'm also activating, I'm developing programs, how to increase access to historically disadvantaged and underrepresented community in STEM subjects such as medical biotechnology. Yeah. So that's why the main reasons that I am busy collaborating with Patrick and the rest of the team here.
Yeah, and I can't wait to learn more about this bigger vision. But let's go first to Dr. Arthur. Tell us your role and how it ties into the bigger vision.
All right. So when Patrick talked to us about this project, I kind of found it realized that this was the best way to kind of work on cancer control internationally, where we can collaborate from different countries, them being in the United States, myself being in Kenya, and of course they're also from different African countries. It's the best way we can get cancer control in low and middle income countries and also globally. And this, not only on cancer, we can collaborating like this will make us really do major changes and mitigations for global cancer and other diseases. So my main agenda here was, or is my main was to try to demystify cancer for the high school students and other people, because the way people take cancer is normally has a different kind of a disease. But I was trying to demystify that cancer is just like any other disease. When got early, people can get treated. When got late, of course, it will be like any other disease and it will kill someone. And my push in this is on early detection of cancers, early diagnosis. So that's why I've been trying to push and global health catalyst to try and get us these new artificial intelligence-based early cancer, multi-cancer early detection kits in low and middle income countries, the ones that you have in the Western world, that we can use to diagnose our patients early, so that we don't have this condition where 70 to 80% of our patients are got in late stage cancer, that is stage 3 and 4. So all of them, 70 to 80, and even some diseases 90 to 100% have to go for palliative care, because there's nothing much that can be done. So that is my push and what I'm really trying to push for in this Global Health Catalyst project that Patrick started and involved us with. Thank you.
Excellent. Thank you for sharing. And Vincent, welcome to the panel or to the conversation. I would like to invite you to please tell us who you are, where you're tuning in from or calling from, and what your role is with this project.
Thank you so much, Vivian, for giving me this opportunity and time to be here with you. It's a great joy to be here. My apologies, please. I just for joining late because I was running late from work trying to come back. And unfortunately, there is no lights in my current settings. So please, my apology for not turning on my video. So the idea from Patrick and Co, or from the US and others from here in Africa. My own role was to answer questions from the students. After the work presentations, we are the ground team here in Nigeria. We prepared, we look for the venue, we sort out things logistic. We look for the venue and then we obtain consent from the management of the schools. I and other team of volunteers that we have, I think about more than 10 of us. And Albert, unfortunately, he's not here. I think he's being engaged elsewhere. So we work on the logistic on ground, and then on the day of presentations, after the presentation from Dr. Fleur, Patrick, and others, and the student took time to ask questions. So I think I'm the one that responded to all their questions that day, because I currently work in the lab as a medical scientist here in Nigeria. So my interest is focused on cancer, early diagnosis, early detections. I'm interested in the in the technical aspect, that's diagnosis. So like in where I'm currently working, we do a lot of pap smear. We do a lot of we do a lot of work in histological samples and both cytological samples. So we deal with them, and I responded to their questions. So many intelligent questions have been asked by the student on that day. So I responded to virtually all the questions, and yeah, it was really nice, and they were happy. And it's a kind of giving back to our motherland, the community. And I think that there's a big gap in Nigeria at the moment, because looking at the presentations, a lot of people tend to, tend to address cancer as a curse, or as more or less like, what can I say, witchcraft. If you are cancer, you have been, they tend to associate you with like you have signed for a death sentence. So they will just take you home, maybe the traditional healer, going from faith healers from one church to another, looking for places to get healing. So we disseminate information to those students. to take precautive actions and ensure that they go for early cancer and gun vaccine, because they're high school children. Actually, the vaccine is currently rolled out in Jalingo, where I am. So encourage them to go and take those HPV vaccines. And if one of them, we recommended that they should go for hospital in case they are sick. They should not stay at home. They should not go to maybe to the pharmacy or to the drugstore to ask for a pain tablet or whatever. Rather, but they should go for diagnosis to understand their condition so that they can be served properly. So these have been my role so far. And I'm grateful for the team, for Patrick and others for their contributions, Dr. Atu and Ishen. Thank you guys for the wonderful work.
Well, thank you for sharing that, Vincent. And I mean, from what you've all shared, there seems to be a lot of work that goes into this kind of collaborations because you're coming from it from different angles. So my next question would be, as you're building this vision, what are some of the either best practices you've learned from other, collaborative projects or from working together so far, that things that are going to propel this project to the next level? What's that vision? And I'll start with Patrick and then go to Dr. Fleury because I know he has to run away at the top, soon. Yeah, and then we'll take it from there.
Thank you, Vivian, for that question, and thank you to everybody. I think what we've learned is that at first we had a little bit of doubt, and when we started this project, we realized that there was an overwhelming positive response from the students. They were actually very, very engaged, and I was actually joining from Philadelphia here sometime at somewhere in early morning. I believe it was around 3 or 4 a.m. When it was being done in Nigeria. And so I recognized that they were very interested and they appreciated the initiative, and they were asking a lot of insightful questions. And I think one of the takeaways for me, as I thought about this project and the success of it, was that the importance of early detection, that there's risk associated with lifestyle choices like smoking and poor diet, and the need to reduce stigma around cancer. And so, if we can emphasize that this life choices, students can make proper life choices as they get older, because we were looking at a very young group of students when we were doing this work. And so we also try to destigmatize, right, that having cancer is not a death sentence. And so we thought it was good, and they were excited really to think about going out and spreading some of the things they've learned. And so we thought that it was going to be like, one of those events where people would say, we really already know very much, or we don't care for this. But as soon as we started it, we saw this overwhelming response from the students, and we see the excitement in their voices and in the participation. So I think that is something that I really took away from this event.
Thank you, Dr. Fleury.
Yeah, so for me, I will say the main things that I've learned in this event, first of all, is excitement of students. That was already expected, because I know one of the reasons there is an absence of precision medicine in Africa is because not many people are trained in this field. So it was for me to provide them with an opportunity to know what biotechnology is. When I speak about I do biotechnology and genetic engineering, people usually think it's two different things, right? My mom used to think I was a doctor that was a genetician, and I had to explain to her calmly what was biotechnology. So for me, it was also to take these children, because these children are the future of the continent. So we need to tell them what are the opportunities, and especially going to a specific type of field which are of benefit to the countries, because cancer is being a very real issues in countries like Nigeria, where we know that a lot of women are affected with cervical cancer and breast cancer, right? And also itself for me also as a platform to propose them with what are the alternatives compared to what is being proposed right now in clinics. And I can even speak of that it not only impact the students, but even communicating with a doctor such as Dr. Achu, who is a surgeon. We kind of discussed, and I introduced him to this therapy, and now we want to collaborate with Kenya and Brazil, and how we could introduce it to clinicians in the specific countries. So that is a long vision for me, to kind of help having more African biomarkers, because a lot of clinical trials are not done with cancer patients from African ancestry. And I believe that organizing such a programs and having so many informative events such as the one that we had will help in closing the gap in this specific aspect. Thank you.
Yes, thank you for sharing that perspective. I'm sorry that we are going to miss you because you have to run soon, but I feel like this conversation, we need to get back, all of us, at some point, because there's a lot to unpack from what Vincent said, from what you've said, from what every one of you has said, because there's so many disparities, there's so many potential areas for collaboration, areas for finding solutions. And some of them are intertwined, from stigma to, thinking it's witchcraft, to the science of it, the clinical trials. I can go on and on. But let's go to Ishan and then Dr. Arthur and finally Vincent on the vision and what the experience you've seen.
Yeah. So Dr. Flory and Patrick actually summarized very clearly what we all actually think. But I think one thing we're all focusing on for the future is we don't just want to have a few informative talks here and there and then just leave it, right? We want to make sure our impact lasts longer. So that starts with, training volunteers and community health workers who can implement like permanent lifestyle changes for the youth. Because as we all know, once we're adults, our habits don't change, our beliefs don't change. So we're going to make change only by talking to the youth. So we destigmatize things and bring all the resources we have in America and more developed countries to areas that unfortunately do not have those resources.
Right. Dr. Arthur. Dr. Arthur, you're muted.
Sorry for that. Yeah, so what I appreciated and came out that I got from this collaboration is that we get people with different skills, expertise, and experiences coming together from different countries, and that helps us at least have a platform that gets things done in a global way, so that we have solutions to challenges that we are having as a continent, and also challenges that we're having around the globe in low and middle income countries. So I appreciate this so much. And so even from students like Shen and Patrick, because with their passion that they still have in the universities, what the passions they have, then they share with us, who have skills and different expertise, and we bring them together, and then we bring solutions to the challenges and the gaps that we are having in cancer control. So I think we should continue doing this in a collaborative framework globally, and if we continue like this, then we'll have this early detection or early diagnosis for all cancer patients, and we'll have early treatments, of course, for accessible and affordable medicine for our patients near where they stay, and also for palliative care for those who have been diagnosed late for different cancer types.
Thank you, Vincent.
Okay, thank you so much. Can you hear me?
Yes.
Sorry, my network is breaking up. So I think there's so much more to be done. I think we're just started. Because from my experience, like, this is the first ever cancer, educative program in high school in my whole region in Taraba State. So, like, most people are even aware, they are not ignorant of, they don't know what is cancer actually. A lot of people don't know actually, and I believe if we can collaborate more, we can do more. Together, we can do better. Together with our effort, with the intellects, the kind of caliber of people we have on this board, I think we can do more, and our impact can outlast just now. And what I've learned so far is that people are eager. There's scanty informations, and those informations are not scientific. The information out there, mostly, they are just hearsay or information that are not scientific, and they are not backed up by medical. They are just information that are just vague. So imagine, like, if you have been diagnosed with cancer, automatically, your relative will take you back home. Like, we have a live experience of about 2 people. They told us that actually their relative died of cancer. One is breast cancer, and the one is cervical cancer. Because in the hospital, they told them that there's nothing they can do. and they have no option that to take them home, and for them to, to wait for the time that whatever. But there's something we can do. The education that we are giving, is something, is already an impact. The impact we are creating, is something that goes beyond us, you know. So I think it's a step forward, and I appreciate the team. And I think we need to do more and do more so that our people, not only in Nigeria, but in other places like Kenya and other part of Africa or whatever. Because I discovered that our situation in Africa is similar. In Congo, the same thing. Here in Nigeria, DRC, Congo, when you go to Mozambique, whatever, our conditions are the same. Our people need information. We need to provide them with.
Oh, I think we lost Vincent. We'll get back to him when he gets back. But I mean, I want to echo, I think what he's saying. I did a project at Harvard Medical School on, and I found out that information is one of the reasons, our people are dying, especially the women are dying from cancer, even the men. So I concur with I love this project that it's educating the communities. And yes, we need to do more. And I'm happy to reach out to you all about, how to use the platform that we have to reach out to our communities in Africa. You mentioned all the other countries. Uganda, it's the same because my case study was on Uganda. People, they are told it's too late. Some think it's witchcraft. Others there's so many factors. So I guess thank you all for sharing that kind of vision. And I guess one of the last things I'll ask each of you is to share one of the, how do I phrase this? So we have what's going on, we have a vision, but the success of any impact is measured on the scalability of the project. So if we are looking to scale what you are doing to other countries, what would be the starting points for that to happen? Starting with Patrick.
So in terms of scaling up, really for us with this project, we're thinking about, since we're doing cancer awareness, we're thinking about expanding this certain to actually other topics, really, because we think about things like mental health and things like infectious disease. And because our team or our club is really focused on STEM as a way of trying to tackle some of those problems, we're also thinking about not only focusing, while our work in cancer is great, we're also thinking about increasing focus on girls in STEM, because we think that, they're very underrepresented. And so I can tell you that my grandfather would listen to the radio, my grandmother would just be in the house trying to make all the meals, and she has no idea what's going on. So women really don't have a lot of information because there is very little access. And for my granddad, who passed, unfortunately, due to prostate cancer, his way of getting information is to listen to the radio. And when he listens to the radio, if there's no health talks about what cancer is or any information about health, then my grandmother has no way of knowing, and he has no way of knowing. So we think about ways in which we can kind of involve girls in STEM, involve girls because they're also underrepresented, because even in our team, we have no female in our team.
There we go.
And so we're thinking about that. And we want to do it on a regular basis. And if we can collaborate even with the high schools that we're working with, so that they can a little bit find a way to incorporate some of the stuff, not the most complicated stuff, but the basic stuff in their curriculum. And we're also thinking in long term, really, if we can develop some materials that we can hand out to schools that can be distributed to schools year round, so that they can continue to give students more information about why this is important. And and as a team, we're really not only scaling up, but also thinking about how we can be adaptable, right? We're thinking about how we can be adaptable as to the other new information that is coming. So I think that there's a lot to be done, and I think community engagement is a huge part, which is what we try to do, and we want to try to do it as much as we can and tell people that this is something that belongs to them. It doesn't belong to us. I might not be there tomorrow. Maybe they would have to figure out how to continue this. So we want to really push for community engagement because we believe that's going to be have a lasting impact, and that is through incorporating some of the things that we're doing into the schools themselves, or teaching girls to teach their grandparents, or engaging the high school students to take responsibility and spread the message more and more. So those are some of the things that we're looking at in terms of the future and in terms of scaling up to do more, but also extend to other fields. I think you're muted.
Oh, it's my turn to be muted. Okay, sorry. I was saying that I think we lost Dr. Arthur, but we'll go with Ishan, Vincent, and
no, I'm still around. I'm still around.
Oh,
okay, Ishan, please go ahead, and then we'll go to Dr. Arthur.
yeah, I think your question is very interesting because we're actually meeting very soon to talk about our future goals and plans. We have a document getting ready where we're all going to share our different ideas. I think the first step is if we can have recurring events. I think this first event serves as a metric to other centers or high schools or areas around that it's possible and successful. But we also want to make it where we have leaders that are local who can speak to the local population, because not all of us are from that area. So they might not trust us fully or see our mission, but if we have local leaders who they're more familiar with, I think that would have a big step towards connecting more with the different populations, not in just Nigeria or cities in Nigeria, but all around Africa or other low and middle income countries.
Thank you. Dr. Arthur?
All right. So for me, of course, as a medical doctor and currently treating cancer patients, the areas that I want us to expand to, because through your help, is I want us to do more clinical trials on early detection kits that are being produced in the US and in Europe for multi-cancer. Number two, for the new molecules, the cancer drugs that are being used in Africa and other low and middle income countries, there are cytotoxic drugs that were made in the 60s that are not being used in the United States or even Europe right now. So when they do clinical trials with these molecules, our patients will benefit because, of course, we have so many patients who can't afford even those very, very old drugs and they don't have insurance cover. So clinical trials for new kits for early multi-cancer early detection and clinical trials for new molecules. And the third one, which is also very important, should even be about number two, or they should come together, is improving on the workforce. Like Kenya right now, we only have, and Kenya, Kenya is one of the countries that people think we are so up there. We have only 58 oncologists of any type, radio oncologists, medical oncologists. We have only 58 for 55 million Kenyans. And these oncologists are concentrated in the capital city, Nairobi. So you see, most of the patients, most of the community members who are in the rural areas, and in Africa, 70%, or even other low-income countries, low and middle-income countries, 70% of people normally live in the rural areas. So just imagine they are left without oncologists. So people normally say that patients come late, but I always say patients are diagnosed late because they start in the dispensary, they go to the health center, they go to another hospital. Then by the time they're meeting the oncologist, the one nearest to them, who will be even 800 kilometers away, they have to spend thousands of shillings to reach. The oncologist will be diagnosing them at stage 3 or stage 4. But the patient started early. It's not that the patient did start early. So the patient is diagnosed late, not that the patient comes late. So those are the things that the workforce should really increase. And I really love what Professor Will, they formed the Global Oncology University. If that can be pushed so that it can have global reach, so that we can have it in our medical schools, it can go to tertiary medical colleges. Then we increase the workforce, the oncology nurses, oncology medical doctors, you see, palliative care people. So those are my three areas where I think we should push on to increase the cancer control that we're trying to do.
Thank you so much. I can't try to summarize that, because everything you've said, I think, is pertinent to the success of or bridging healthcare gaps in our countries. And I think, Vincent, are you still there?
Yes. Thank you. Sorry. Sorry, we're having issue of light, so I forgive me if I did not turn my video off. So on, sorry. And okay, thank you so much. And the importance of diagnosis cannot be overemphasized. I believe if we can train our personnel, especially laboratory personnels, on imaging and the old way of diagnostic of cancer, I think it's greatly going to help a lot. Because I believe if we have competent technical staff that can perform good testing procedure, that can able to detect not only collecting samples, but able to detect the presence or absence of cancer, which is going to be helpful in our overall goal as a team. So I believe if we can invest more, like in my current city where I'm currently living now, we have the population, including the villages, about 4 million populations. In my country or my state, more than 4 million people. Can you imagine that we only have 2 histology laboratories, 2 histopathological laboratories, only 2? And at present, we have only one oncologist specialist, and people that specialize in histopathology, they are not much. So, and people that have been trained and satisfied to be competent in doing pap smear, in doing a pap examination, in carrying out histological techniques, only few people now. So I believe we can invest in people, invest in people, technical staff, and then we can able to, contribute positively to our overall goal. Another thing I want us to take note is that another issue that come on board is the issue of affordability. From my experience, most of our people they cannot afford testing, for pap smear or whatever, or tissue from cervix, whatever, or whatever type of tissue. Most people cannot afford to pay for those tests, because you look at the poverty index in my current settings, and the issue of religion too, because our people here, we have religious people, especially those extremists. They are not comfortable coming to talk to a person that is not part of their religion sects. So it's another great challenge that maybe we need to go through the kings or the emirs. We have kings here, maybe, and then the religious leaders. We need to pass through them. We need to collaborate with them so that we can able to raise awareness. We need to go through their pastors, because those people listen to their pastor more than the way they listen to their doctors. From my little experience here. So we need to collaborate and work hand in hand with those people so that we can able to achieve our goal. So, and then reach out to people, reach out to communities that are unreachable. And then with the good news of cancer is treatable. Cancer can be cured if only we can detect it early. So this is the message that we all should carry. And there's hope. Hope is not gone. We can do it, and people can survive it if only we can detect it early. So these are the messages that we need to collaborate more to work on it. Thank you.
Thank you so much, Vincent. I think that's a great segue into wrapping this up. First of all, you've mentioned all these religious leaders, chiefs, kings. If you have contacts with all these people, please send them my way so that we can reach out to them and say, how can we work with you to spread the message and inform, communicate with the public. But that aside, I just wanted to give each of you like an opportunity to say one word you're taking away with, you want our viewers to take away from this panel. Starting with Patrick. And
I have a sentence. I just want to say young people are the future leaders of Africa, and that they have the potential to drive the changes that is needed on that continent. So let us invest in them. Thank you.
Thank you. Ishan?
For me, I'm very passionate about the youth and youth development. So the fact that we can educate young people and change the world slowly. I like how the world's getting more connected and there's a flow of knowledge through everyone. So I'm glad that I can slowly work towards that goal of mine.
Thank you. Dr. Arthur?
Yeah, what I can say is that we let's never let's never give up, and let's keep on pushing until we see the changes that we need for this world, the global world, as global citizens, for our patients, for prevention, of course, for everyone else, so that we have a healthy global family. Thank you so much.
Thank you. And Vincent?
Together we can do it.
Short and sweet. So with that, I want to say thank you all for being here. Thank you for sharing about your project, your passions, your vision. And if there are ways that we can join you, collaborate, please let us know. Contact people with the GHC and media like ourselves. And we, like I said, together we can do it. We shall do it. We have no other choice but to do it. So with that, our viewers, thank you for watching this episode of Global Health Series. Till next time.